Subscribe to The Honest Critique for current affairs, movie, book, and product reviews. Also, make sure you press the bell icon to get notified whenever we upload a new video. The views, information, or opinions expressed during the video series are solely those of the individuals and do not necessarily represent those of The Honest Critique and its employees. The following video contains strong language which may be offensive to some viewers. Viewer discretion advised.
Hello and welcome to The Honest Critique, where words and stories are our infinite space. Today we have with us Dr. Swaiman Singh, joining us from the farmer protest sites. He is a cardiologist at the Newark, Berth Israel Medical Center, the Heart Hospital at New Jersey, and also the founder of the Five Rivers Heart Association, which is a humanitarian organization working for the medical assistance of the protesters in harsh circumstances. So thank you so much, Dr. Swaiman Singh, for joining us today. So my first question to you is, what perhaps made you stay in India on the outskirts of the capital early last year for an indefinite period of time?
It was a tough time for myself. It was a tough choice because, I understood that if I was to stay back, that I could lose, what I had worked for the past 30 years to achieve. I had just gotten into interventional cardiology fellowship. So, basically I lost that now. So I understood the risks, apart from my pay and being away from family, I basically put my career at risk. But on the other hand, what I saw was that the people I became a doctor for were on the streets and they were suffering. So if I really became doctor for them, that basically this was a litmus test for me. Why did I become a doctor? Did I become a doctor because I wanted to be, this doctor, whatever, make a lot of money? Or did I really become a doctor for these people? So I think when I sat back and I said, my reason for being a doctor were these people, and there was never a bigger need, as there was a big lack of doctors. We were still in the middle of the COVID pandemic, and there were a lot of outbreaks at that time. So I decided that, I really couldn't go back, and, I had to stay. So that's why I ended up staying. It wasn't that hard. Honestly, when I thought about it, when I sat down, it became an easy decision at that time.
You have been at the heart of the social movement. You've seen the evolution of such a large-scale social movement unraveling its discourse. What, according to you, is one factor that unites the farmers, and the efforts of the Punjabi community, joined by people from all over the country? What is it, one thing that still continues to unite the farmers, continues to unite the protesters? And what is the one factor you think that looms large, given the long stalemate period that has prolonged ever since the last negotiations happened between the farm leaders and the government? So what, according to you, has the atmosphere been like so far at the protest sites all over?
What kind of unites us all together is that, the world community has come together and said, what, these laws don't make sense. That there is definitely something wrong with them, right? So when there's something wrong with something and there are people on the streets speaking up for it, then I think as human beings, it becomes your duty to join them. I'm not saying, speak up against the government, do anything, but at least be there for them. If I'm a doctor, if they get sick, then I should be there to take care of them. Because whatever they're protesting for is legitimate. The world community has said that, that their fight is right. So if they're fighting for right reasons, then as human beings, it's our duty to stand up with them. I think that's what brings everybody together. And you have to realize that as humans, that tomorrow somebody can point the finger at you, that you might be at no fault, but somebody just points the finger at you that they want to, do whatever with you. Then you want other people to speak up for you, right? This is your chance when somebody else is in trouble to speak up for them or stand with them. So I think that's what brings people together, that this is one of those unique times in our lives where something is happening right in front of our eyes that's very wrong. And now it's on you that, are you going to sit there or are you going to do something about it? So everybody that's here is basically doing something about it. Everybody who's sitting at home is obviously just sitting there watching. The atmosphere is really good because, again, listen, I'm not saying that these farmers are in a really good state of health. It's horrible. It's a COVID pandemic. They're sleeping on the roads. With every wind, their files are blown away. Their houses are blown away. We understand that the rains are just around the corner, and that's why we're speeding up to build these houses. That tomorrow, the gutters are going to overflow. It's going to be a mess. We realize that. But the morale is still high because they know that they're fighting for their rights. They're fighting for their future, their kids' future. So that's why the spirits are high, but we also see step by step all of the things that we have to overcome now and in the next few months before we head to another winter. As far as the stalemate, so the farmers have made it pretty clear that I think there were about 12 meetings that happened between the leaders and the government, that the government admitted that there was something seriously wrong with these laws, that they needed changes. So they came to a conclusion like, listen, if you want to make 200 changes to a law that's 220 words long, then why don't you just revoke the three things and then let's sit on the table, let's rewrite the bills. So that's the conclusion they have at, that listen, we want to talk to you, but you have to understand what we're asking for, that these laws cannot work because you can't have these many amendments today. And I think that's the stalemate, that the government is basically stuck up now, that they made something, they realize it's wrong, but now they know that if they put a step back, then they might have to undo all the things. They might have to do all the things that they have done in the past, which are wrong. I can't sit here and count those things, but obviously they're in the media, that if the government takes their foot back here, then they'll have to do this, this, this. And that's what I think is kind of scary for the government. Now they're losing elections as well because they seem to be losing the support of the country. So I think the future, for the government should be to end this as soon as possible, honestly. Or else, they didn't gain a single thing in the past 11 months. They've only lost. So, I think the government should try to sit and have these meetings as requested by the unions and try to figure something out sooner than later.
Right. The outbreak of the second wave of the deadly coronavirus pandemic has consumed so many lives, and our healthcare system is in shambles. Do you think that this crisis could have been averted with a timely response? And how far do you think the protesters have been able to achieve the adherence to the COVID protocols and guidelines? So I want you to answer this in two parts. Firstly, how this crisis could have been averted, and what is the on-ground situation like as far as combating COVID is concerned?
100% this crisis could have been avoided. In the past few days, I was at the protest, but we also spend our nights at in Delhi. We get calls from patients that we take care of as far as our telemedicine group. Me answering calls, and that's why I'm like exhausted, like just tired of whatever stuff we do. And then we also go see patients in the field at their houses. And something we realized is that we never thought that paracetamol would be sold in the black market. We never thought that people will sell beds in the hospitals. We never thought people will be selling oxygen. We never thought there would ever come a day when humanity was being murdered basically on the streets. And the government is quiet, Everything is here in Delhi. There are oxygen concentrators, there are medication, but it's just for the rich. If you can pay the price, you can get the medications. If you're a middleman, middle class, low class, forget it. You're gonna feel so bad. Imagine your loved one is on the bed and the doctor tells you, go get me this injection. You're ready to sell your house for that injection because your mom or dad will never come back. So that's the situation we're putting the people of Delhi in. Literally, just sell everything and go get that injection that probably doesn't even work. Many of the things that they're requesting for doctors are not even part of the guidelines. It's just like throwing this, kitchen sink at them. It's so sad. Seeing these patients is so sad. And I keep doing this is because we really feel we changed some lives. We saved a lot of lives. And that people are so thankful. Like, doctor, thank you for just taking my call. They have few questions, we answer. Because if we wouldn't have answered those questions, they would have also been running around on the street. And I'll give you an example from a patient yesterday. The patient was like, oh, their mother was, oxygen saturation is 50%. I'm like, is that even possible? Recheck 50%. All right, doctor, you have to come. All right. I left my clinic. Usually we do this at night, but yesterday I went during the day to see some patients, especially just because of that one particular one. I go to their house with my own pulse ox machine because the patient's talking to me. I put the pulse ox machine and the reading is 98%. But their pulse ox was broken. Basically, it wasn't working. It was a brand new thing, but again, something that was probably sold at a very high price that didn't work. It's so sad that the system is broken in so many ways. Not just medication, not just doctors, not hospitals, but also medical equipment. Imagine that patient's family running around for oxygen because they think that the patient's oxygen level is like 50%. And I come in and just put a pulse ox on her finger and it's 98%. And I'm like, I didn't know what to do at that time. Like, get mad at the family or really get mad at the system? So I think, the system is really broken. It's really sad, but it's also an opportunity for people like me to come in and really, really make a difference and really feel good about themselves. So that's how I look at this situation. It's like, great, man, God is like giving me this chance to really be able to do something that I might never get in my life again. So like, I'm taking full advantage of it, running around, whatever, because I know this day will never come back. Sometimes, some way we're going to figure it out. But for now, it's basically on us to make it happen. This is a very tough question, because you have to be here to realize what we're going against. The people don't trust the government. All these media reports about vaccinations killing people, they're out there. And the government's not saying anything. When was the last time a government official stood up and said, no, nobody died from this vaccine. Stop lying, right? There's so many questions on the vaccine. There's so many questions on overall the coronavirus. Where did it come from? So there's so many questions. When the people of the country don't trust their government, it becomes very hard for people like me to convince people to do something. And as far as the masks, a lot of the people didn't wear masks before because a lot of people were coming into the protest with masks on and doing bad things and giving us a bad name. So people decided, hey, we're not going to wear masks. Now I'm going back and trying to convince these people. It's like, hey, it's okay, man. Let's wear a mask. We're making a difference. We're probably giving out thousands of masks already. We're making a difference, but it's slow. We're convincing the people for the vaccine. They're ready to get the vaccine. Now the government is not giving the vaccine. It's been 6 or 7 weeks I've been begging for the vaccine. We have plans for social distancing. We're building houses for social distancing. We have given out sanitizers. Again, like you said, Good Samaritans are doing a lot. The NGOs are doing a lot. But one thing people have to realize is that the NGOs should be there to support the government, not to be at the forefront. But sadly, in a situation like this, it seems like the NGOs are at the forefront and the government is trying to fill in plugs. They're the ones who are actually saying, I'll take care of the F, you just take care of the A, B, C, D, E. And it's sad. So I think it's maybe good. One thing we have to know is revolutions don't happen in a day. And this is a revolution where people of India are waking up and they're realizing who the hell they voted for. That this is our government and this is the people, the morale of the country, where in the middle of a pandemic, when you needed the doctors, they're not showing up. When you needed the hospitals, they're closing their doors. So you're now realizing the system that you built. And now it's an opportunity for us to sit back and say, okay, well, this should never happen again. So what are the things that we're missing? What were the things we can correct? to make sure this situation never happens again. So I think it's a great opportunity. It's a learning moment for us that we can sit back and really try to make a difference. Again, just like this is an opportunity for me, this is a great opportunity for the government to kind of self-reflect and kind of get going for the future.
I think it is important for viewers to know at this stage that what sort of COVID relief actions have been taking place from the protest side. What sort of work that your organization has been engaged in, as far as immediate relief to COVID infected patients is concerned. So would you like to elaborate on that?
I just speak for myself. I've been going to the Morcha meetings. I've talked to the farm union leaders, written to the CM of Delhi, Haryana, Punjab for vaccinations. We've single-handedly probably given out thousands of masks, thousands of sanitizers. We have made plans for this main stage to how the Sanjukta Morcha can take care of social distancing. We have plans for isolation center here in case Delhi, in Delhi gets really bad. And I've volunteered, all of our doctors have volunteered their time. We're also fighting a battle in Delhi where we're ready to do whatever we need to do, and we have been. It's a tough time. We're trying. We're doing our best. The farmers are with us. I mean, they are extremely supportive of whatever I say, and they do it. Whether it's wearing a mask, sanitization. I think they just want to hear it from people they trust. And if we tell them like, hey, do this, they really do it. Like honestly, I can just go on the stage tomorrow and tell everybody like, hey, get a vaccine, and they will get it. But if we don't speak up, they won't, because they have huge questions for the government that they are not answering. They're not coming here and answering, or they're speaking up on TV. So it's basically on us to tell our people like, hey, do this or do that, or you know what, it's okay to do that. It's okay to wear a mask now. It's okay to sanitize your hands. It's okay to get the vaccine. But it just means we have to work extra harder.
Moving on to another aspect, which is the neglected region, that is the rural parts of the country, and there is a surge of so many cases. Unfortunately, there is a lack of documentation, and the rural health infrastructure is something that really needs to be ramped up as far as increasing its efficacy in catering to the cases is concerned. So given the lack of awareness in terms of the importance of getting vaccinated in those parts is concerned, the lack of and the shortage of vaccines availability that is there, what sort of steps, what sort of measures do you suggest can be useful in accelerating the number of people getting vaccinated? Do you think, what are the ground level problems that you encounter in terms of helping these regions being fully vaccinated?
People are not turning up because they have huge governments on, questions on the government and tensions. There's a lot of bad media out there, bad false reports. The vaccine can do this and that. And what the government needed to do was step in with their doctors and actually answer those questions. Say what's corona? What is the kill rate of the virus? What is the vaccine? What are all the side effects of the vaccine in all the different languages here in India? And really, really get to the patients and to the farmers and to citizens of India to say like, this is the vaccine. But the problem is the government doesn't have the vaccine. They're really short on the vaccine, so they have no reason to go out and preach, because then they know if they go outside and preach people to get the vaccine, they're going to ask for the vaccine, and they don't have the vaccine. So that's why the government has been on the back, kind of on the back foot, and really hasn't gone out and try to convince people. So you're an educated person. If somebody was to say, hey, I'm going to give you a vaccine, would you just get it? Wouldn't you want to know the data behind the vaccine? Wouldn't you want to know the side effects of the vaccine? Well, that's the situation these people are in. No one has told them. People haven't even told them what COVID is. So first you have to teach people what the problem is. Then the second part is what the solution is. You're taking away their pensions that, hey, if you don't get a vaccine, you're not going to get your pension. So that's another added threat. So you're trying to threaten these people to get the vaccine. That's not the way it works, man. It works by teaching people, by telling them their rights, giving them a choice, and they will do it. You come to the Morcha site, I guarantee you, we'll have a vaccination rate greater than 95%. Because there will still be 5% people that that only God can convince. But I tell you, you give me a chance, I'll get you a vaccination rate 95%, if not 100%. But you have to sit there. You have to know the people. You have to sit there with the people and bang your heads with them and say, hey, you know what? This is the stuff. This is the data. There were 23,000 people in that study. There were 25,000 people in that other study. These vaccinations have gone through phase 3 trial. They're on phase 4. They really work. This is the data behind it. We don't know the long-term consequences. We don't know the long-term data because we haven't had the time to study the long-term data. And give them basically all the answers to the questions, and you know what? They will get the vaccine. It's just the government doesn't have the vaccine. Now we're trying to, get this vaccination from America, and we're trying hard on the back end, trying to do that.
And now my question to you is, what are the policy measures or what are the suggestions that you would like to give that are immediate in nature and need to be immediately adopted by the healthcare system as far as, damage control is concerned, as far as saving the lives of so many people is concerned? I mean, in terms of damage, there has already been an immense amount of damage that has been occurred. But what sort of measures that you think, in your experience, would be useful in achieving a clampdown on this second wave is concerned?
Things have calmed down in Delhi a bit. We've gotten over that initial real bad hump. Things will calm down. People are again taking precautions. They realize, how deadly this virus is again, if they didn't know the first time. I think what you can do is, remember how the Delhi or the central government wanted to convert all these stadiums into prisons? Well, it's time to convert these stadiums into hospitals, right? This is the time to convert stadiums into hospitals. And, just like they did in America, you build these isolation centers in the stadium. There's no better place than a stadium to do that. You have open space, where there's good air, and all you have to do is build structures with it, and you can make a big difference. Again, you can have drive-through vaccination drives. You don't need people standing in lines. You just basically build a center where, just like we go to like McDonald's or wherever, you get your food, you park your car there, somebody gives you a boom on the arm, and you go next. Drive-through vaccinations, you study basically whatever's going on around the world. What are the other, we're really behind. And there are other governments who have really set, great standards. Like just from where I come from, America. I was talking to my friend yesterday, and I said, how is the corona thing in our hospital? He goes, there's really nothing. He goes, anything, and all the patients that we have are from that first phase that are in the ICU. Otherwise, we hardly see anything because, vaccination drives have been so great and people are taking precautions. And now they're thinking about lifting up the ban on inside masking. So, it's great stuff that's going on in America, and we're just lagging behind. So we have a blueprint. We can study New Zealand, we can study America, we can study all these different countries to see what did they do. And all we have to do is basically apply the same things. And it's not hard. It's not rocket science. Better vaccination numbers, convert big stadiums into hospitals. Bring out doctors to help, give them proper PPE kits. Make sure your frontline workers are vaccinated and they don't feel scared about helping people. I mean, it's hard for me to find a vaccination for myself. I've been trying hard to get my team vaccinated since we're on the front lines, but it's so hard to find anything, and all people do is turn us away. So it is a sad situation in India. It's definitely a sad situation.
Now I want to ask you that since you're a frontline warrior, has there been support from the government in terms of support in terms of mobilization of resources, in effective supply of medical supplies, or any sort of mobilization in terms of achieving targets for vaccination or efforts to take care of the protesters? Or has there been an all-pervasive narrative that, there might be conversations of physical eviction of farmers on the pretext of the deadly second wave that has kicked in?
The Republic of India will never forgive the government if they were to forcibly evict these farmers. Humanity will never forget this government if they were to do that. Because I'm telling you, it won't be easy. These are the same people whose ancestors have fought a lot of wars, and they've given their lives for whatever they feel is right. So I think the government doing anything to abuse their powers upon these people will not be good. The farmers are ready to do everything that the World Health Organization is asking for, that governments all around the world are asking for. COVID bodies are asking for vaccination, social distancing, wear a mask, sanitize. So there's nothing new here that you can say, hey, farmers are doing this. The same way you have Jhonpadpattiyan, where a lot of poor people live close together in small neighborhoods. I forgot the name of that, Birali or something in Mumbai, that famous, Jhonpadpatti. So you have these, where slums, right? Slums all over India. I mean, we live in slums here in Bahadurgarh. We're like middle of slums. So how can you evict these people and not those people from the slums? There are people sleeping on, like yesterday I went to Chote Sahibzade, the Gurdwara in Delhi, and the day before, I think, or a couple of days before, we were in close to Red Fort, and a couple of days before, we ended up close to Tihar jail. And what we were noticing is a lot of people sleep outside, at night. So what about those people? COVID guidelines are great for the rich class. Even might work for the middle class, but they're horrible for the lower class. You got to get these people vaccinated so they can go back to work. They can't afford to sit at home. The rich people can afford to sit at home. These people cannot. They can't afford to social distancing. I mean, what are you going to do? Or they don't have the resources to social distance, So I think, it sounds great on the paper that the government can evict these farmers, but it's a reality. It's a thing that will never come to reality. I was sitting outside today. I told I got really tired. It was like 4:30 or so. I'm like, man, just give me like 5 minutes. I want to take a break. So I got out of my clinic and I just went outside and sat down alone. There's some trees here. So I just wanted 5 minutes. And I was like, how the heck did we get ourselves into this situation? And, when you are in a situation like this, what you do is you don't try to solve all the problems at once. You solve one at a time. So let's take it one at a time. Our first solution can be take back the 3 laws, send all the farmers back home. You achieve the greed, you already, if you were going from 0 to 100, you're already at 50 right now. Then you say, okay, next step. Let's get all the vaccinations from all around the world. Whoever's trying to give us vaccination, let's get it. You're at about 75. Now let's bring in as many doctors as we can from around the country where there might not be a pandemic or they're not suffering. Let's try to get them all. Let's give them housing in our hotels, free housing. Maybe even give them a stipend. Let's bring them here. All right. Now you got doctors who are willing to spend time with the patients, talking to them. And what's that going to do is that's going to prevent those 5% of the people who are going to be admitted in the hospital or the ICU, or the 20% of the people who are going to admit it to the hospital, to not end up those 2% who are going to die, because you have that force. And you're going to lower that number of people who are dying. So I think what you just have to say is pick your fights and make this fight into a winnable battle. And all you can do is, increase your probability. Take away the farmers, by actually the right means, take away the laws. Bring more doctors. Build a couple of more hospitals in these stadiums. Listen, it's not, trust me, man. I'm fighting this battle. It's not that bad. It's not that bad. You just need manpower. You just need people who are motivated to help, and you just need people who are not scared.
I mean, I can only pray at this point, Doctor, that there is a perfect alignment between, the availability of resources such as vaccination or all those essential medical supplies that are, acts as a relief for a COVID-infected patient, and the demand that there is. And the supply is something that is uninhibited by any roadblocks such as the unfortunate black market accumulation of these resources. And I know how difficult it must be for you. And thank you so much for what all you do. And I wish you all the best in your endeavors. And thank you for joining us for this interview and pouring your thoughts over, the COVID crisis and the farmer protests. So thank you so much once again.
Thank you so much. I know I sound tired. I'm sorry about that.